HIV and AIDS in Sherbourne, a chiropractic public health initiative. Project created by Arman Ali, Jordan Caldwell, Corey Grossman, Taylor Pratil, and Jaspreet Sandhu. Why is HIV/AIDS a public health concern? The HIV/AIDS epidemic first came to light in the early 1980s in North America. In North America, San Francisco was where the first AIDS case was recognized. A French-Canadian flight attendant, deemed Patient Zero, was connected to many of the early cases of AIDS in the U.S. It was in 1982 that the first known case of AIDS was identified in Canada. Since then, the number of people living with HIV globally has steadily increased. Although scientific breakthroughs have decreased the number of deaths from AIDS-related illness by slowing the progression of HIV into AIDS, it has presented a public health issue whereby there is more opportunity to spread the infection to others if individuals do not take care in ensuring safe sexual and drug injection practices. Since the beginning of the epidemic, almost 75 million people have been infected with the HIV virus, and about 36 million people have died of HIV. Globally, 35.3 million people were living with HIV at the end of 2012. 1.6 million people died from AIDS-related illnesses worldwide in 2012. In Canada, at the end of 2011, there were an estimated 71,300 individuals living with HIV, and 25% of these people are unaware of their status. The estimated number of HIV prevalent infections in Canada since the epidemic began is charted in this graph, showing a steady increase in the prevalence of HIV infection over the years. In particular, there are certain areas and populations within Canada where HIV infection is more prevalent and poses a greater public health risk. Toronto is one metropolitan that has the highest HIV infection rate in Canada. The HIV incidence in Toronto is higher than Ontario, minus Toronto, and Canada as a whole, as indicated by this graph. 20,000 people have tested positive for HIV in Toronto since testing began in 1985, which represents 65% of all HIV-positive test reports in Ontario. Sherbourne is a Toronto street that spans between Front Street and just north of Bloor Street, and includes the communities of St. Jamestown and St. Lawrence, and falls within the Central Toronto Public Health Unit region. The Sherbourne community is well represented by the lesbian, gay, bisexual, and transgender community. Situated in a large urban city makes this community particularly susceptible to HIV transmission because of the higher disease prevalence and the opportunity to transmit the disease through unsafe sexual practices and intravenous drug use is greater compared to a more rural and sparsely populated area. The neighborhood along Sherbourne Street has had the highest incidence of HIV infection in 2012 for males between the ages of 20 and 54, compared to the surrounding areas of Toronto. The HIV epidemic in Canada is concentrated in specific populations. According to 2011 national HIV estimates, people living with the HIV include an estimated 35,490 gay men and other men who have sex with men. This represents 50% of all people living with HIV in Canada. 14,200 people who used injection drugs. This represents 20% of all people living with HIV in Canada.
How can this be addressed? The Healthy Living Project. What is the Healthy Living Project? This is a 3-module, 15-session intervention program aimed at people living with HIV. Each session is delivered one-on-one, and the programs are tailored to the individual participant, including things like cognitive behavioral techniques and skill-building exercises. The target population is HIV-positive persons at risk of transmitting HIV. Goal of intervention is to eliminate or reduce sexual transmission risk behavior, eliminate or reduce injection drug use risk behaviors, and to improve healthcare practices and quality of life. More specifically, the modules focus on developing positive strategies for managing symptoms of depression, anxiety, complex medication regimens, injection drug use, and sexual risk behavior in order to avoid unwanted consequences for themselves, their friends, families, and partners. Module 1. centers on the quality of life, psychological coping, and achieving positive effect and supportive social relationships. Module 2 is on self-regulatory issues, including avoiding risky sexual and drug use behaviors. Module 3 looks at access to health services, adherence to treatment, and active participation when it comes to decision-making in the medical care system. Evidence for the program: studies done on the effectiveness of this program show that there were significantly fewer HIV transmission risk acts reported in the intervention group compared to the control group at 20 months post-baseline. Intervention participants also had a 10% greater self-reported adherence to their HIV medication as compared to control participants at 15 months post-baseline. The appropriateness of this program for the Sherbourne population is that the program acts to reduce sexual transmission risk behaviors, reduce injection drug use behaviors, improve healthcare practices and overall quality of life, and improve adherence to antiretroviral therapy. How the Healthy Living Project can be implemented in chiropractic practice. Chiropractors, as part of a family healthcare team, may serve as the portal of entry for HIV/AIDS patients seeking MSK-related care. HIV/AIDS patients which require further intervention may be referred to other healthcare professionals within the community which adhere to the Healthy Living Project concept. Sole practitioners within the community can identify at-risk patients and educate and inform these patients as to the different form of services which they should be seeking within the community, such as the Healthy Living Project. Practitioners can also answer any questions or inquiries made by these patients while receiving chiropractic-based treatment for MSK-related conditions. It is the responsibility of the chiropractor to become educated as to the format and benefits of this program in order to better educate patients who fall within the at-risk population. Ultimately, the chiropractic paradigm emphasizes holistic care that takes into consideration the physical, social, and psychological well-being of patients. The Healthy Living Project is aligned with this philosophy, whereby we can work to treat the patient and not just the disease.